100 years after the Indian Citizenship Act declaring citizenship for all Native Americans born in the U.S., Minnesota is turning its focus now to health. Today, leaders unveiled the Office of American Indian Health with a big goal in mind. John Croman is here to explain. John?
You know, Randy, there have been people doing the work of healthcare in indigenous Native American communities across this state, but this marks the first large-scale effort by the state to partner with those clinics and support them in closing healthcare gaps.
On the Capitol steps, a time to celebrate the launch of the new Office of American Indian Health in Minnesota.
We have the hope for more audacity. We have the audacity to say, show us the money. We need the resources and the funding and the capacity.
State Rep Alicia Kozlowski is one of those who pushed through the legislation to create the new office, which will be part of the state health department.
And it's long overdue. It's long time for us to have an impact on those statistics, which means we have to think differently.
He suffered from heart disease and diabetes.
Lieutenant Governor Peggy Flanagan spoke of her father, the late Ojibwe activist Marvin Minniepenny, who lost a leg to diabetes.
And hearing from a healthcare professional at another system who said, we don't think that was necessary. That can't happen.
Longtime Native health practitioner Chris Rhodes will lead the new office, which will have a staff of 10 and a budget of $9 million. Most of that money will go to grants and partnerships with tribal clinics and nonprofits that treat urban indigenous communities. The office will also gather data about what works and what doesn't.
When it comes to American Indian health data, a lot of times our data isn't included because of small numbers or because of lack of access.
Rhodes points to the homeless encampments as the most visible reminder of the health inequities for Native Americans, lower life expectancy, higher rates of heart disease and diabetes.
But our communities have everything we need to thrive and move forward when we lean on our culture, our language, our land.
To that point, the office will also bring a renewed effort to lend on traditional healing methods that are culturally affirming for indigenous Native American patients in Minnesota. Back to you.
John, thank you.